Sits sort of more on the edge of the bed, so it's just easier to control than for me the movement. And you can see that I'm kind of almost raising the bed to my height because it's much nicer for me. I don't have to compromise my spine or biomechanics. So you get the patient to cross the arms. Now what you do, so you stand a bit more sort of behind the patient a little bit, and then you find, remember 11, 12 are floating ribs. Yes, so they finish kind of like in the midline. So go at the bottom, so my index finger between the ribs. And what I do, relax for me, goes contralateral side bending. So I open up and I feel that mobility. Go to the next rib. Yeah, don't lean on me, don't lean. No. Let me. So you just kind of be relaxed and I let me move you. Yeah, so just let me move you. So, and you see my hand is not behind lats and anterior to latissimus dorsi. So that's latissimus dorsi, it's just a bit more anterior. Okay, and I just do side bending like that. Good, so feeling for that separation of the ribs. Very easy and nice movement to feel, definitely not difficult for that. Okay, so that would be sort of opening up of the rib cage. Or if you want to do the same side bending, you'd be closing down the rib on that side. Go to the next one. Feel that again, rib spaces. Next one, feel that rib space. Again, good. Come back, and again that one. Okay, so really feeling for that movement. Either opening or closing down. And then the patient can lie down supine for me. Just get a heel roll. The t-shirts falling over. Okay. So guys, for rib 2, so if you look at the clavicle, so that's a clavicle, and underneath there is a first rib, but we're not going to test first rib with this test. We're testing more rib 2 to 4, okay? And posterior rib we'll show you after lunch probably how to assess. But yeah, so when we palpate, we do some stuff for the first rib, so it's more behind the clavicle. But we're gonna look primarily at rib 2 to 4, okay? So lift your head up again for me a little bit, good. Good. Now what I do with this, so of course if the patient goes shoulder pain, I won't be able to do this test, yeah? I wouldn't do this test enough what I did in sitting. But for some people, you can do that. Now if you maybe turn your head away a bit, good. Again, if you're treating female or says female, you ask for consent. If you explain what you're trying to do, I'm sure everybody will be comfortable. But if you're not explaining and you're straight away putting the hands, then it's a bit, a bit invasive. So just tell them, if you're not comfortable, because some people may not be comfortable for a variety of reasons, that's fine, we can do other things. So just place that on the second rib. What I do with my elbow, I distract and I just drop that arm and then rebound. So I'm just feeling for that mobility. Okay, go to the next one, distract, and then back down, and then relax that way. Okay, so again, feeling for the give in the system. Yeah.
Do we need to do sack if people have big pack?
Sorry?
People would have big pack major or big pack muscle.
So yeah, sometimes you might not be able to do this test. Yeah, if there is for whatever reason you cannot do, you can't feel, that's okay. I'm just showing lots of different options, and yeah, all right. Now, can I get you to lie down on the side facing that way? Just come towards me a bit more. Good, a bit more, perfect, okay. So this one is a bit more the lower ribs, guys, yeah? Okay, maybe just bring your pelvis sort of like it. So you bend your knees as well? Yeah, more, yeah, so you're more comfortable, okay. So yeah, so you kind of, your hand is in a space and at the front more. Because that's lats, so it's difficult to feel. I sort of more at the front a bit more. And to be honest, I'm gonna change my hand. Yeah. So what I do with this, I distract, drop, and then come back. Feel that, Now, of course, if you have shoulder instability, you wouldn't do this. Please ask the patient as well, any shoulder issues, so they are comfortable and so on, yeah? So go to the next one maybe again. So you distract, you drop, and then you let it go completely. So you want that rebounds, feeling for that mobility. Next one, distract, drop and then come back. Again, distract and then come back. Okay, good. And then come back. Okay, so that would be this test. And the last thing, I get you to lie down on your tummy face down. So this is a nice technique for assessment, but also could be as a treatment. Those are people who are very tender with PA, and some of you are, because you've got maybe muscular pain or fascial pain is too much with pressure. You can do on the rib. Yeah, lovely technique is this one I'll show you. So remember guys, if the patient's got pain, let's say on this side, sorry, I'm going to show my back again, with extension or inspiration, I can, you see my thumb? So my thumb really comes on top part of this rib. And then with this hand, I'm going to glide down, put stress on the rib, looking for that pain response. So for this, I just kind of come on top, like that, and this is doing nothing, just relaxing, and this hand on top, applying that stress. And you can imagine how much nicer is this when you're putting the whole thumb on top of the rib, rather than just doing this. So as a treatment can be really, really lovely, I think as well. So I love this. Rib mopes like that, much more nicer. Even for your mom, if you find something today. Good, and go to the next one, and then again, and apply a bit of a stress through that. So it's really going towards opposite buttock for that extension, inspiration. For flexion or expiration, for this side, I need to stand on that side, yeah? But because you guys are videoing, so I'm gonna do this side for expiration, flexion. So guys, I'm just gonna go there. You might want to come around there to see it. If you can see it, that's okay then. So this time, what I'm gonna do guys, here, have a look. So I'm gonna go underneath that rib, and this hand's gonna push it up towards that shoulder. So that's more for flexion, exhalation problem. So block, go underneath, and then I'm pushing towards that shoulder. And then you can do like a treatment, like 45 seconds, 3 sets, lovely. It's very gentle, it's very nice technique. Again, and then coming. So really the whole thumb is flat, the hand is not twisted or wrist is completely relaxed. And then you just apply that light, okay? Maybe higher, pain is here. So see how does that feel. All right, so that was for flexion, expiration. So under, or for inspiration, extension on top of the rib, pushing towards that butt. Okay?
Yes.
Any guys questions on that?
Well, for those upper ribs, will you...
Which ones?
Upper ribs.
Rib 1 and rib 2, I'll show you after this.
And those hidden between the scapular?
So you do the best you can.
Okay.
So maybe you take the scapula out of the way a little bit and try to do that, so that's fine. That's okay. So just make sure, yeah, so the scapula, the arm is a bit out of the way, so you've got a bit more space for that to do as well. Yeah. Okay. All right, guys, so have a go at this one. Thank you.